Once again, my name is Ruben Ojo. And if you're familiar with this channel, you would probably recognize my face. And we're doing something different for the very first time. So this channel has been for more like professionals taking the health education license exams. However, I'm trying to expand the channel to covering health education topics and public health discourse. So without wasting time this morning, it is my joy and privilege to have on here with us the one and only Dr. Agnes. I'm going to misspell the name, and I'm sorry to Daniel, sorry to you as well. Is it Dr. Agnes Haikali? Is that right?
Perfect.
Oh, okay, nice. All right, Dr. Agnes, so, can you please introduce yourself? I'm the only one who knows you here. So can you introduce yourself for everyone watching?
Okay, thank you. Good morning, like you said, to everyone. My name is Agnes Haikali, a general practitioner from where I come from, or a medical doctor. Been practicing about for now, it's close to actually 10 years, I think. Yeah, close to 10 years, almost 10 years. I graduated med school 2015. Then did my internship, then worked in the obstetric department for quite some time, and then left that area to work in the general department again, if I can just simplify it in that way. But through all that whole journey, I've been trying to improve myself in certain areas. So I've done a diploma in sexual reproductive health. And currently I'm busy doing an advanced diploma in aesthetics medicine. Yeah, it's just more to come. I think I'm still a bit interested in almost anything and a little bit of something in medicine. So I'm just trying to advance myself with diplomas here and there to find what exactly is my tick. But for now, I can say women's health is on top of my list of to do things. So yeah, that's just little old me.
All right, all right. Sounds like so much is going on in that space. And of course, for those who do not know, I was in the same medical school with Dr. Agnes. So a lot of people actually don't know about my medical background. That's something I've tried to hide for a long time now. So yeah, that's that. One of the brilliant minds out there. And she says she's from a country in Africa. That country is Namibia. So if you go to Namibia for holidays or something, make sure you're looking for her. Spend out of her medical money, she has it. All right. So again, like she said, she's going into women's health, and I do believe as an health educator, that is something we don't talk about enough. If you look at the different death charts, morbidity death charts everywhere, I mean, the number of deaths that happens to women, it's just a lot when you look at those numbers. And again, I said to myself before doing it, this is sexual health. Why are we doing it? So in your own words and from your experience, how do you describe sexual health? And why do you think people shy away when we want to discuss things like this?
Well, sexual health definition is quite a big title wording to go through because it has so many compartments and different aspects to it. But in a nutshell, when we talk about sexual health, it has to do with infections that are sexually transmitted, your sexual justice, your sexual pleasures, and sexual well-being. So when I say your sexual health, I would dive more into the area of, for example, things that has happened to in a woman's life to impact sex negatively or positively. For example, violence, things like rape, which is a very common thing almost everywhere you go. In Africa, everywhere you go, women are being the numbers or the statistics of rape victims are very high, especially in women. And then talk about the sexual function itself, the arousal, the desire, then we're talking about the sexual health. And then the justice is where we go into your sexual rights, what you prefer, what you want, when you want to have sex. Then we talk about in certain countries you have when and where and how a woman can have sex. So when is it allowed? When is it not allowed? And that also touches a little bit on the religious beliefs, the countries where you are, where you're, in which aspect you're looking at it from. And then also, when we go to the well-being part, we're talking about the respect. We're talking about the safety, how the woman feels safe to have sex with a certain person or this partner of hers that she chooses, or the willingness to open up, especially after a sexual past that was traumatic or that was a very good experience. Now you're in a different experience or sexual environment. How far you are willing to explore in your sexual life or areas. So yeah, so basically the sexual health part is a big, but in simple form, that is how far I can summarize it.
All right, so my question would be, why do people shy away from talking about this? You know, when I posted the flyer, someone asked me a question and said, did you block your mom on WhatsApp so that they don't see it? I was like, this is a typical African behavior. Like, why do we shy away from discussing subjects like this?
That's because, okay, from my personal point of view, putting my career aside, when especially coming from an African home, I'm sure almost everywhere in Africa, the upbringing up, especially when it comes to sex, is quite similar, where in the sense that as you're growing up, at the beginning is seen as a taboo, something you mustn't do, then boom, they expect you to get married, have kids, and then you're wondering, how am I supposed to do all of this if I don't know how to have the kids? So it becomes a taboo because nobody in the African home really talks about what is sex. What does it mean? What does it mean when you have sex, when you don't have sex? How do you do it? You understand? What can you get from it? From both the medical aspect about it, cultural aspect about it, or the religious belief about sex. Nobody really talks about these things, and people tend to hide it away and make it seem like at the beginning it's something you're not supposed to do, and then boom, you're an adult, and then all of a sudden you're supposed to be able to know what is sex, what to do with it, when to do it, how to do it, and find your own way around it. So basically, people tend to shy away from the topic because it's something that has always been seen as something that should be secret, something that should be hidden. And especially when it comes to the female child, it's something that you mustn't openly talk about because then you will be labeled so many bad things. So that's, I think, from my point of view, that's why people tend to shy away from sex.
Yeah, and I agree with
Sexual.
you. I think I do agree with you on that point. Again, so as this progresses on, we'll dive into more clinical things. However, this is a disclaimer for the people watching. I'm a health educator. One of my job is prevention and creation of awareness. So we won't be sharing drugs and giving you medications to prescribe to you to go and buy for any reason on this channel today. That's not why we are doing this. All right. So let's talk about something that is becoming more of an endemic in the world right now, and that is PCOS. For those who don't know what PCOS is, I believe that would be polycystic ovarian, polycystic ovarian
syndrome.
That's why I'm not the doctor.
Yeah.
That's why we have the doctor here. So tell us all about it. I mean, I do know a few things about it here and there. And let me give you a quick start. So 1 in 10 women in America right now has polycystic ovarian syndrome. I think that is just awful. So tell us all about polycystic ovarian syndrome from your expertise.
Firstly, I can say it's a very complicated but simple condition to manage, in the sense that it has different stages. 4 stages to be quite exact. But all in all, it results from an abnormal function of the hypothalamic pituitary ovarian axis, meaning that if you look at it in the medical term, the brain has to send signals down to somewhere for an organ to function the way it needs to function. So the brain needs to send signals to the ovaries and the uterus to do what they need to do. So during that excess, that point or that pathway of communication, that's where the abnormality comes in or the problem comes in. So there's either an excess or an excess of a certain hormone, or there's a diminishing or a minus in a certain function. Where I'm going with this is where I can now say with PCOS, you have an excess in the androgen hormones. These are, if I can just shorten it, the male hormones, so your testosterones, for example, in the female, they are a bit in excess. And then there's the part where it's not functioning well, it is in ovulation, where there is absolutely no ovulation, or the ovulation is what we call oligo ovulation, where there's, if in simple terms, little ovulation. So almost no ovulation. So every woman is supposed to ovulate every month, but then you'll find in PCOS, you have that they ovulate maybe once or twice a year, or maybe 6 times a year, when they're supposed to do it 12 times because there's 12 months. So just depending on each individual. And then there's what we call hyperandrogenism. That is now also the androgens are also in excess, where it shows signs like where you see the woman has facial hair, like a beard, or they have because of those hormones, the skin darkens and becomes like a thick darkish discoloration, those type of things. So not necessarily that every woman will present with all of the symptoms, but there is a criteria to diagnose this polycystic ovarian syndrome.
Okay, because I was about to ask you, like, so once a lady comes to me and be like, "Hey, Ruben, I've not ovulated for like 3 months in this year." Oh, I should be like, "You have PCOS, right?"
No, not at all, because for you to diagnose it, you need, like we said, it's in the name, polycystic ovarian syndrome. So your ovaries need to be polycystic, where we say the criteria, there should be at least about 20 or more cysts in one ovary.
Wow.
And then you have to yes, and then you have to have the biochemistry that shows you the hyperandrogenism. So biochemical markers where you have the hormones that then regulate or that are responsible for the menstrual cycle, and when it should start, how it should, what should flow, what phase it should be in. There's also abnormality there where we look at the follicular stimulating hormone, the luteinizing hormone, and the binding hormones. So we look at all of that, and then before we can say, yes, this person has polycystic ovaries.
Okay, sounds
And
good.
then we have then the layman's symptoms, where we say when somebody comes in, you can maybe suspect before you confirm with the investigation. Things to suspect is somebody, a female that comes to you, let's say, has a problem with conceiving, infertility. So you need to investigate and find out and make sure that it's not polycystic ovaries that are causing the infertility. Somebody that comes to you that, no, I don't have a problem. I get my period every month, but I'm just worried about the facial hair, cosmetics. So look into it, what's causing the facial hair, what's causing the hirsutism. Somebody with obesity, especially increased abdominal fat circumference, that can also be a question mark as to think maybe polycystic ovary, or somebody who has sleep apnea. Why are they having sleep apnea? Can also maybe want you to trigger and just make sure it is not polycystic ovary. Not to say that the things that I just mentioned now, when somebody has them, that they only indicate polycystic ovary. They can be symptoms and signs for something else, but they are one of the markers that will lead you to think of polycystic ovary as well.
Okay, sounds good. Sounds good. I love the fact that you were able to point out the physical layman's symptoms. Because again, most times as an individual, you're unable to understand what are androgens, what are biomarkers. You don't know that if you're not in the medical field. However, there are some signs and symptoms that are subjective that are able to point to, okay, maybe this is what I'm dealing with. Now, I have two questions in one for you. And one of those questions would be, when you have PCOS, what is the probability that you are unable to have a child, you are unable to conceive? And again, now when you answer that question, you did mention in your introduction and you said it is easy to manage. Now, how easy is it for you to be diagnosed with PCOS and still be able to conceive later on? How do you manage it?
From a medical point of view, just because you have PCOS does not mean you will not be able to have children. Like, remember I said it has different stages of how far the polycystic ovarian syndrome or what category you have. But the best way I can say to answer this is that we need to know first the extent of the biochemistry. So what brings out the signs or the symptoms, like I mentioned, the hairiness, the not being able to ovulate and things like that, not getting your period. In most times, the first two stages is whereby sometimes you just need to lose at least 5% of your weight, and then your period and your cycle returns into a normal cycle, and you're able to fall pregnant without any medical intervention. The other time is where we maybe need to put you on a certain combined hormonal contraceptive to try and get you into a normal menstrual cycle, and then see if you will conceive naturally. If not, then is where we can introduce now medications like clomiphene, citrate, and letrozole to try and induce ovulation for you to be able to fall pregnant. So it's not to say that once it's polycystic ovary, definitely you're not going to be able to have kids at all. All in all, it's done. But then again, like I said, I'm a Christian, so nothing is impossible with God. We can diagnose you with the stage 4 or grade 4 polycystic ovarian syndrome, and then miraculously you have a child. So, but medically, it's not to say that definitely once you have polycystic ovary, you will not be able to conceive.
I like the God factor you put in there, because I was also going to ask you, I'm a Christian as well, so I believe even with all of these medical conditions that fly around, we've seen people get off HIV and things like that. So yeah. However, is there a way to prevent this from happening at all? Like, are there things you can do? I mean, if you don't want HIV, you use condoms, you abstain from unnecessary sex. So, is there preventive measures to PCOS?
Because of the fact that it's an inherited condition, so meaning it comes through genes, there's nothing you personally can do not to get it. But then there are measures you can take to be able to make sure that your hormones are balanced and that you have a regular menstrual cycle, so that you do not have those kind of problems. But you cannot prevent it from happening at all because it is inherited. So basically, it will just be the awareness, knowing what it is, knowing how to control it and how to manage it, that will be able to assist you.
Okay, sounds good. So let me just add to that point. From an health education standpoint, I think one of the things we kind of tell because I work with a cancer organization in part, all right, one of the things we do say at the end of presentation is know what your family history is, all right? Know what your family history is. And I think that is important to everyone. You have to understand what runs in the family, what runs in the family. So I think that's a job well done on PCOS. So, I mean, I probably had little knowledge before, and I do hope our people at home are finding this very useful. So quickly, this next one we are jumping into is something a few people didn't want me to talk about. Vagina tightening. It sounds weird to their ears. They feel like, oh, Ruben, you are a Christian. You shouldn't be doing this. But I will. I want to. So it's a project you
All
want
right.
done. So talk to us about it.
Okay. Project, not per se, but project maybe, because this then falls into the aesthetics that, remember, I said I'm currently doing an advanced diploma in aesthetics. So that will follow under that, whereby aesthetics is just making everything beautiful or trying to beautify something for yourself.
But
All right.
why are you
So,
trying to beautify? Why would a lady try beautifying a private part? That confuses me a lot.
okay. Before we get to that part, I just want it to be clear that the vagina is a very, very, very beautiful, beautiful structure because no matter it's able to stretch and still come back into its form where it was before. When I say stretch, when you give birth naturally, it stretches. But then once you have recovered from the birth and everything, there are certain exercises that you can do just to strengthen the vaginal muscles again to almost nearly to what it was before, right? But then in my practice, I've seen so many times where women come in complaining that no, my husband complains that the sex doesn't feel the same anymore, or it's not tight enough, or my husband would rather want us for me to have a tighter vagina, so it seems to him like the first time we had sex, or when he disvirgined me and things like that. Yes, you would find those things. So what then vaginal tightening in the aesthetics part means is just that we inject fillers in the vaginal walls to make it seem like it's smaller. So we increase the volume of the spaces of the walls of the vagina. So imagine the walls are this much. So you put in kind of like a cushion on the inside to make this area here appear a bit smaller, and then feel a bit tighter for the male partner.
That that's a lot for me to take in right now. I'm just gonna stay on a few things now. I understand because this is going on in Africa now and in Nigeria a lot. However, people are not doing it medically. They are using herbs, using some drugs,
Mhm,
using some.
mhm.
So that concept alone pisses people off. Why do you have to use some cream and all that? And again, I understand if the man is asking for it. However, seems like it's fast spreading, even without at the request of the man. So what do you say to that? Is it something that every woman should do?
Well, the statement everyone should do, not per se that I'm encouraging anybody to change or alter themselves if they do not want to, but um, having it done may also help to boost the woman's confidence in a way, because then she would receive compliments from the male counterpart that, oh, despite having so many kids, or despite having gone through a vaginal birth, you still manage to feel or remain intact. That's why you probably find that certain women do it with or without the male requesting it, but they just do not want to have that judgment or that criticism about. There's a certain saying that goes around that she has a loose vagina, for example. So instead of going through that yourself, being called and labeled names because of your sexual preferences or because of what you do in your sexual life, then some women tend to choose or opt for that option because they feel that, okay, it's not just as tight as it was before. So, and I really don't want to go through surgery, because there is a surgical procedure that you can actually do, that you tighten the vaginal wall and take off some pieces, that they do not want to go through that whole surgical procedure. So this is more just like a mini surgical procedure, something that does not last forever, can last depending on your body up to 2 years, and then you would have to go for the procedure again. So it's something that can really help boost confidence.
Okay, so I understand the confidence part. I understand the self-esteem and men complaining and things like that. I would really understand that. One of my questions would be, how expensive is this if you have to do it every 2 years?
It's not as expensive as the operation though, that I can say. But I can't give you the exact figures right now because it's dependent on how much of the product one needs to inject or infiltrate or put in the vaginal walls. But it can range from as little as, let's say, 2,000 and above. That's now Namibian dollars. Converting it to US, not sure, maybe around 2,000, probably somewhere around 500, I think,
Trust me,
US,
you
maybe.
are not going to get that for $500 in the United States. I am sure about that.
But this is that, like what I'm saying, this is just injecting. It's kind of like if you've heard of the Botox and the fillers that women use to take out wrinkles in their face and make a certain area that looks a bit not puffy or fluffy or plumpy enough, then they just inject volume, breast enlargement, where they put in silicone um in the breast to make their breast appear bigger. So it's kind of in that form, but this is a filler that you inject into the tissue, into the cells, that later on dissolves by itself, not something that you have to go and operate and remove again later on. So hence
Interesting.
why it needs to be repeated after a certain time.
Okay, interesting. I understand a 2 years maintenance period. Now,
Not necessarily 2 years. It can also be as little as 6 months.
just 6 months? Now, is this depending on the number of sexual activities you engage in that period?
No, it just depends on how fast your body can reabsorb the substance, if I can put it in that way.
Huh, okay. All right. My final question on this is going to be, who should be paying for it? The man or the woman?
That is not a medical question, but let me try and answer it. Um, from a Christian point of view, I'll start with that since I'm a Christian. I would only advise a married couple to engage in sexual activity because of how the Bible depicts it, yes. So in that context, it's a husband and wife. So it doesn't matter who's earning the income, it's coming from the household. So everybody pays for it. But then again, like I said, I'm a medical doctor, so not only am I a Christian, but then also I am a scientist. So that part, then I guess whoever is willing to pay for it can pay for it.
Whoever is willing to pay for it can pay for it. I know a few
Yes.
women in my corner right now who would say the man wants it. The man should be the one to pay for it. And I understand that point. I get that point.
At the end of the day, the man is the provider, so he should provide.
And I think the man is the one actually, doing the action. So yeah, you should open up your account and pay for this thing if you want it done. So right,
Exactly.
right. So we do have a little over 6 minutes, and we quickly will talk about two things. Number one,
Okay.
just for women listening out there, how do you
Mm-hmm.
maintain your sexual health?
How to maintain your sexual health? That is also another very tricky question to answer because then it would fall in again. Like, remember at the beginning when you asked me about sex, the first question about describe sexual health. So, how to maintain it is, when did you actually start having sex? What was your experience about having sex at that certain age? Because having sex has so many effects to the female body, to the male body, that people don't really take into consideration because most of the time sex is just about enjoyment when it has to do with a whole lot more about it. So how, in a nutshell, medically, I can say after every sexual activity, always clean up. Like I always tell my patients, cleaning the vagina, there's only two faces that you need to clean with cold water. So that's the face that everybody sees, and then the face that only one person sees. So cold water to rinse off, that helps to minimize the rate at which, yes, bacteria or fungi grows. Fungi loves warm, moist places. The most common culprit is Candida. So rinsing with cold water is always a very good idea. Then making sure that you stick to one sexual partner at a time. Um, there's a certain myth that's going on. I'm not sure if it's the same in your country, but here, women like buying intimate wash to apparently clean the vagina. Then they'll buy so many soaps and chemicals to try and clean and make it smell nice, which in actual fact, it only destroys the natural bacteria that's supposed to be in and around the vagina, that's actually supposed to help it maintain its natural scent or natural smell, which is at the end of the day the aphrodisiac for men or for their male counterpart. So the vagina, like I said, is a beautiful organ. It cleanses itself. It cleans itself, so it will never, unless it's like an infection like candida or certain bacteria, sexually transmitted infection, then you will need medication to help and clean that out. But you never do need to put in intimate washes in your vagina to maintain its health, to maintain its smell, or make it smell like roses, because it's not supposed to smell like roses. It's not supposed to smell like strawberry. It has its own identity. It has its own natural smell. So the only thing we need to make sure, clean cold water is usually the best way to go. And then eating healthy foods, like I'm sure this is something that is common everywhere. Pineapples, cranberry, those are very good for the vaginal health. And making sure you stay on point with your probiotics. This is for the female counterpart. For the male counterpart, I'm not sure if it's very common on that side, but here, circumcision. Circumcision is also another good way to maintain, especially from the medical health aspect, to make sure that you're sexually healthy and you are maintaining it. And also the same to wash up after every sexual encounter. And then also the same again to stick to one partner, because then you know and you have a little bit of control of what pathogens and what bacteria you are inviting to yourself.
All right, all right. I think I think this is kind of biased because the women had more things to learn. You probably spoke about the men for 10 seconds. Who does that? However, we are going to pardon you based on the time we have left. All right. So we do have other questions. However, I think this is something that can be done on another day, because I do believe, actually, I had a couple of questions people sent to me, but because of time, we are unable to look at some of those questions today. So once again, I want to say a very big thank you to you. You've been the very first guest for this session on the YouTube channel. You've been the very first guest, and I did learn a few things, and I believe everyone who will probably listen to this out there will learn a few things as well. So Dr. Agnes Haikali, thank you so much one more time for coming. We appreciate you, and good job with your aesthetics and whatever you're doing out there.
Thank you for having me, and I really do hope I did let somebody know about something they didn't know, or change a certain perspective that people didn't know about, and just made sure that they're going in a very good direction or a better direction. Because at the end of the day, like I said, I'm more interested in women's health. So if a woman is not healthy, the male will not be as well. So we need to make sure that she is first before she can take care of the home.
All right, I like that. If the woman is not sexually healthy, then the home is not healthy. Now that's actually a very nice pickup. That's a nice pickup. All right. Thank you so much for your time. It's 6, it's probably like close to 7 a.m. here. I have to get back to sleep as well. So once again, adios amigos. Bye-bye.
Goodbye.
All right.